let's now go into the writing and revising a manuscript for a high quality journal. We are very lucky to have Dr. Viviany Taqueti, who has been just named as the head of the publications committee. She will be starting early this year. And she's at Harvard Medical School and serves in the cardiology department at the Brigham and Women's Hospital in Boston. Thank you for coming here today and to talk about so important subject.
Thank you very much, Dr. Fuster, and good evening to you in Paris. It's really a pleasure and honor to be here to give the last presentation on writing and revising a manuscript for a high-quality journal. So I don't need to tell you that good scientific writing is a key skill for physician scientists, and success at publishing is truly essential for scientific progress as well as academic career development. In today's presentation, we'll review briefly why write, general principles of writing, key components of a paper, how to get started, and how to get to publication using some examples from Jack. So why write a manuscript? Well, obviously to publish your work and disseminate knowledge, advance the field, and impact clinical practice, ideally with the goal of improving patients' lives. But also, the writing process is critical such that you receive feedback under peer review in order to refine your research question, approach, and findings, and also to improve your impact on the field. And also to convince others of your expertise, to establish credibility, collaborators, your academic portfolio, and ultimately to use these data as preliminary work for grants and also for practice-changing guidelines. And ultimately, no publications is essentially a non-starter in academic medicine. So writing a manuscript and getting it published, again, ideally in a high-quality journal, does not actually start with writing. It really begins before data are collected. And at the time of hypothesis generation, one must consider what are the gaps in current knowledge. It's ideal to address important and unanswered questions and ask yourself, how can these results impact practice? Avoid incremental work that is available, partly because it's simply convenient, and design your study to yield answers, even recognizing that there will always be resource constraints. But envision what your title will look like, your abstract, your tables and figures, and the manuscript text will follow from there. Furthermore, consider your stakeholders. From the editor's perspective, they want to ensure that the paper is significant and accurate. The reviewers want to ensure that conclusions are justified by the results and the data presented. The readers want to quickly understand concepts before deciding whether to even invest in details of your work. And as a writer, you want to convey contributions to the broadest audience while still convincing experts that your findings are credible. So your job is really to facilitate all of these goals by structuring your manuscript across multiple levels and communicating clearly and in a focused manner. So tip number one, focus, as Dr. Fuster said, on a central contribution. Communicate this in a very brief title, ideally less than 15 words. And this really constitutes, at one level, the most important element of a manuscript. It should represent a single but memorable point. And for example, can you ask yourself, will other colleagues still be able to describe the main contribution of that paper a year later? The text, tables, and figures should focus on transmitting that central idea. And a central illustration is a great way to encapsulate that further and to provide a summary illustration that can be used for later presentations and for dissemination of the work. Define the technical terms clearly, but use them minimally. Really focus on simplicity. Don't overwhelm your reader, but convey a clear message. As Einstein said, the goal is to be as simple as possible, but no simpler. So here's an example that I took from this week's JAC, specifically on Manuscript entitled Soluble ST2 Predicts Outcome in Chronic Heart Failure Beyond NT-proBNP and High Sensitivity Troponin T. You can see this is a complex topic, but it's conveyed very simply the results in what this manuscript is about to show us. Tip number 2, tell the complete story in the abstract. For most readers, this is the only part they will ever read. And I suggest using a broad structure where you begin with the context, asking yourself what question or gap will this manuscript fill? Move on to the content. What novel approach did you use to fill the gap? Followed by an executive summary of the results. And then finally, the conclusion, where you interpret your results to answer the question posed within context and then highlight how this will move the field forward. So from that same manuscript in this week's JAC, you can see the authors begin with the background. Soluble ST2 is a biomarker related to inflammation and fibrosis. Very simple, very quick. But they move on to the objectives, which is to assess the independent prognostic value of this biomarker in chronic heart failure. They go on to explain their methods, again, very simply, looking at individual patient data essentially as a meta-analysis to assess the role of this biomarker in prediction of chronic heart failure and as related or compared to some existing biomarkers, NT-proBNP and high-sensitivity troponin. They go on to describe their results in great detail, but in a high level, and then they conclude that it does impart independent predictive value essentially by showing that it associates with multiple outcomes, including cardiovascular mortality and heart failure outcomes, and perhaps should be considered in a multi-marker panel for assessing patients' risk for heart failure events. Tip number 3, deliver the results as a series of figures connected to a central contribution. Your results must convince your readers that the central claim is supported by your data and by logic. So what I find helpful is to outline a sequence of declarative statements that become ultimately titles of figures and headers of subsections, which allow clear progression of your steps so your paper becomes easy to follow by anyone, even those who are not directly in the field. The title of each figure should communicate essentially the conclusion of each analysis, whereas the legend explains how it was done. And the results are not the place to interpret findings or speculate. That will come later. So from that same manuscript, you can see the central illustration here showing the biomarker-based patient classification and outcomes in this group of 4,200 patients. And you can see very quickly that even though it's complicated in some ways, this figure, you can see here that the authors essentially show that by adding another biomarker, a third biomarker, soluble ST2, in both of these cohorts, it adds incremental and non-redundant information to better risk stratify patients who already have elevated NT-proBNP and high sensitivity troponins to essentially further describe risk in an otherwise kind of heterogeneous patient population. Tip number 4, communicate why the paper matters in the introduction. Assume that your audience is made up of busy and distracted non-experts, and your introduction is not an opportunity for a broad literature review, but it is a chance to start with what is a big scientific clinical problem that you're trying to address, and then progressively narrow to demonstrate what is the gap being addressed by this paper. It should end with a summary of your approach that parallels how the results and figures will be presented. And so you can see here that the authors with this manuscript start by highlighting that yes, chronic heart failure is a big problem, but accurate risk stratification remains challenging, and there is controversy still, even within guidelines. There's differences and discrepancies between the American and the European guidelines. And therefore, there may be some value in considering a new biomarker, which is associated with a different pathophysiologic mechanism, namely the activation of inflammatory and profibrotic pathways. And so there is some preliminary data already that suggests it may be valuable and then what they set out to do, which is to assess the independent prognostic value of this biomarker, in addition to existing clinical biomarkers in a large international cohort of patients with heart failure. Tip number 5, explain how the gap will be filled, discuss limitations, and the relevance in the discussion. The first paragraph should summarize the results and focus on its meaning, whereas the next paragraphs should anticipate criticism, address weaknesses, the existing literature, and any opportunity for future investigations. The last paragraph describes how the paper will move the field forward and logically leads to a straightforward conclusion. Avoid hyperbole, acknowledge and certainly reference the contribution of others. It's key, particularly considering some of those folks may serve as your reviewers. So from this week's JAC, you can see that the first sentence of the discussion is a summary of what the manuscript accomplished. And then they go on to their study limitations by outlining first, second, third, etc. And then finally, leading readers to understand how this biomarker may deserve consideration as an element of a multi-marker panel, together with existing biomarkers. So, how to get started? Number 1, focus your time where it matters most, namely the title, the abstract, the figures, and then outline and fill in the text. Number 2, writing a manuscript requires constantly clarifying the central logic of your scientific claim, which you have many opportunities to do in an academic center with other colleagues during scientific meetings, during discussion in group meetings, and with collaborators. And this really serves as a bridge connecting the collection of data, which often happens with a smaller group of investigators, to ultimately writing a paper, which will be reviewed by experts in the field and ultimately published to a much wider audience. How to get to publication? Well, writing, submitting, and revising is an iterative process, meaning it takes time and you learn every time you do it. You learn from others, and I would suggest model high quality papers in the field, like the example that we reviewed today from Jack, and read as much as possible, not just Jack, but obviously other top cardiovascular or general journals as well. It will improve how you write and how you think. Work closely with collaborators, not just in your specific area, but broadly. Have an open mind, be humble, take feedback well. This is not an area to be personally offended, but it's really an opportunity for learning. And don't get discouraged. It can take a year or more from submission to final publication. And rejection's the norm. You just heard that actually even 5% acceptance is now the norm at top journals. And use the peer review process to get better. Address all comments carefully and professionally and learn from every experience. Ideally, you want to become a reviewer because then you will start to see what it is that others are seeing when they're reviewing your work. This is a reference that I included from PLOS, recently published in September of last year, for further reading if you're interested. And with that, we'll take questions in our discussion panel. Thank you.